Fryns syndrome is a very rare genetic disease that causes defects at birth. The abnormalities can be located in the skeletal system, cardiovascular system, gastrointestinal system, pulmonary system, and the nervous system. The cause for this syndrome is unknown, but scientists think it is due to an autosomal recessive condition, and it affects both male and females. If a patient is thought to have this syndrome, the physicians will normally do a detailed family history and pay close attention to family members and siblings that have birth defects and physical abnormalities. To diagnose the syndrome, physicians will look for 6 clinical features. Not every case is the same, and many of them vary drastically, but these are the 6 main features: a diaphragmatic defect, a distinctive facial appearance, distal digital hypoplasia, pulmonary hypoplasia, at least one characteristic associated anomaly, and then affected family members who may have the same syndrome or have been born with other birth defects. The prognosis for this syndrome is not good. Most of the time, the fetus will die before being born due to a natural miscarriage. The prognosis does increase if there is no congenital diaphragmatic hernia found. Congenital diaphragmatic hernia is the birth defect of the diaphragm. Malformations of the diaphragm allow the abdominal organs to move into the chest cavity. This causes incorrect lung formation. This is a major cause of death to many infants because it causes multiple lung problems. There is a distinctive facial appearance in patients who have this syndrome. There is wide spacing between the eyes, and there's an abnormally large space between the nose and the mouth. There also have wonky shaped ears. Stubby hands and feet are also common characteristics with malformed fingertips. Pulmonary hypoplasia is where the lungs are not fully developed. This causes problems when breathing. One or both lungs could be affected. This is a common effect from the congenital diaphragmatic hernia. People with this syndrome normally have one of these associated anomalies. When physicians are trying to diagnose a patient with Fryns syndrome, they will be looking at the family histories to see if any family members have been diagnosed with this syndrome or have been born with any birth defects. There is no cure for this syndrome. Surgery and other treatments are offered to the patients. After the patient is born and stabilized, they will work on the congenital diaphragmatic hernia, as that will be the main priority. Counseling is offered to the family members who have a patient with this syndrome. Here are my sources. Let me know if you have any questions. Thanks for watching.